this is Farm Doctors of OZIOMA, and today we'll be talking about cardiac arrest. Now, what's cardiac arrest? Cardiac arrest occurs when the heart suddenly malfunctions, leading to loss of breathing and consciousness. This is as a result of an electrical disturbance in the heart that stops the heart from pumping blood to the rest of the body. An arrest simply means to stop or to bring to a halt. And at this point, it's important to mention that cardiac arrest is not the same as a heart attack. A heart attack is a circulation problem. It occurs when there is obstruction in blood flow to the heart. But cardiac arrest is an electrical problem that occurs when there is an electrical disturbance in the heart that makes it not to function as it should. Now, what are some of the things that can cause cardiac arrest? Arrhythmia is at the top of the list. Arrhythmia is an irregular beating of the heart. That is one of the major things that can cause cardiac arrest. Coronary artery disease can also lead to cardiac arrest. And actually, a heart attack can lead to cardiac arrest. Some congenital heart diseases, like babies that are born with heart problems, could eventually cause or lead to heart attack later in their life. And an enlarged heart, an irregularly big size of the heart, can cause a heart attack, and so many other things. Now, what symptoms do we see when somebody is experiencing a heart attack? Right before a heart attack occurs, there could be symptoms like chest discomfort or pain, heart palpitations, the heart beating faster than it should, weakness, shortness of breath and dizziness, things like that. And as a heart attack occurs, you see things like loss of consciousness, sudden collapse, breathlessness. You see the patient doesn't have a pulse and things like that. Those things can be similar to a heart attack, but there are, like I've already mentioned, there are differences. Now, how can a heart attack be diagnosed? The first thing, or one of the first ways that heart attack can be diagnosed, is using an electrocardiogram. Electrocardiogram is used to measure the electrical activity of the heart, and there is also what we call echocardiogram. It's not like an imaging of the heart to see if there is any problems in the heart muscles, maybe a part that is not. Another one is echocardiogram, like an imaging to find out any damage in the heart muscles. There are blood tests that can be carried out to check the potassium and magnesium levels in the blood, because those affect the way the heart beats as well. And then chest x-rays and other tests that could be carried out to diagnose cardiac arrest. Now, what are the risk factors that predisposes somebody to having a cardiac arrest? There are things like family history. When you have a family member that have had cardiac arrest in the past, and there is a risk that a patient or a person can have cardiac arrest. Sedentary lifestyle, obesity, hypertension, high blood cholesterol, smoking. These are things that can predispose a person to having cardiac arrest. This doesn't mean that the person must have a cardiac arrest. They are just risk factors. So these are things to watch out for in a person's life. If you have one or more of this, then you know that you actually have a risk of having cardiac arrest at some point in your life. The ways to prevent cardiac arrest is, first of all, to limit this or to minimize these risk factors. If you're hypertensive, make sure you keep up with your hypertension medications. If you're obese, you have to lose some weight. If you're diabetic, keep up with your medications and lose weight. Have a very active lifestyle, to keep the heart active and working as it should be, to keep blood circulating as it should. Quit smoking, quit the use of illicit drugs. Age is also a factor. As one ages, the risk increases. And low potassium and magnesium levels in the blood is also a risk factor for cardiac arrest. In addition to the things I already said about prevention, we'll get regular heart screening, maybe once in a week, have checkups and blood tests, and living a heart healthy lifestyle, basically eating healthy foods and keeping active can cardiac arrest be managed or treated? Without an immediate treatment, cardiac arrest can actually lead to death. So the first and immediate response to a person having a cardiac arrest is usually CPR, cardiopulmonary resuscitation. Chest compressions and mouth-to-mouth breathing into the person to resuscitate them. And defibrillation, this is usually carried out using a defibrillator that sends shock waves or electricity through the patient's chest into the heart to get the heart beating again. And for people who maybe have high cholesterol levels or have coronary artery disease, people that have blocked arteries, that is already a predisposing factor, they could get coronary bypass surgery, to reduce their risk of having another or a potential cardiac arrest. And people that are hypertensive are encouraged to continue with their medications, because these antihypertensives, some of them actually help in preventing or in the management of cardiac arrest after a patient must have had one in the past. For congenital heart diseases, a corrective heart surgery can be carried out to prevent a potential cardiac arrest. So in conclusion, cardiac arrest, like I said, is actually life-threatening, and it's something that needs immediate and quick response. When someone around just collapses and stops breathing, it's important to resuscitate the person fast so that the person doesn't die or end up with some kind of brain or other organ failure because of lack of oxygen. So we have to watch out for ourselves, watch out for our community, the people around us, make sure that we are living a generally healthy life to prevent these kind of problems or diseases in the future.